Hi there, my name is Dr. Linda and I'm the founder of ThanksDoc. And this is just a quick presentation just to take you through how we work. So this is a presentation for our pharmacy partners because we aim to put a doctor in every pharmacy in order to deliver clinical services. So who are we? We're the only digital and physical doctor on demand service in the UK. So that means not only can we deliver services digitally, so like telehealth services, online consultations, online prescribing, but we can also deliver the service physically, having the GP physically in your pharmacy to deliver clinical services. So we match businesses with our doctors on our platform. So we're a B2B to C, so we're business to business to consumer. So we aim to put all of the GPs in every pharmacy in the UK in order that we can scale and also to cover the pharmacies with the much needed CQC that is necessary to deliver these services. So in simple terms, we put a doctor in every pharmacy for free and we offer these services. So a number of services like in-person consultations, referrals, blood tests, private prescriptions, scans, airwax removal. So all of our GPs are qualified to deliver these services. So it just makes it easier in terms of logistics and getting a GP and booking appointments. So you just need to book one person who can deliver all these services in your pharmacy. So how we work, we send you the paperwork and you can have a read through it and you can have a look at our standard operating procedures, our SLAs, and then we register your pharmacy under RCQC as a satellite location. That means our doctors can go to your pharmacy in order to deliver these clinical services because these clinical services are treatment of disease and disorder, which comes under CQC regulation. So you can book any service that we offer. You set the price, you take the bookings, and you take the fees. So you only book our doctor once you've taken the fees from the patient, if that makes sense. So it's a win-win solution. So we don't get involved in your pricing. You know your own clients, you know your own business. So you set the pricing, you take the bookings. Some of our pharmacies are very old school, so they don't like to use all of these different systems, booking systems. They simply charge the customer, take the fee, and write down the customer's name and time on a sheet of paper or in a booking book. So some people like to do the old school way. It makes sense for them and it works for them. So there's no sort of tricky platform that you need to maneuver and you take the fees from the patient. So for example, once you've booked the patient in, you've taken the fees, so the money, the cash is in your hand, and that's when you book our doctor. So we don't want you to book our doctor when actually there's no fees that have been exchanged. So this is an example case. So for example, the pharmacy books the following for patients. So he might book a patient. Let me take myself, I'm sort of in the way here. Maybe I can put it here. Yeah. So he might book a patient for 1 o'clock for airwax removal for £69, another patient for 1:20 p.m. and that's a face-to-face consultation for £89, and another patient for 1:40 p.m. And that's a menopause consultation. The private prescription, so altogether that's £99. So you can see that that pharmacist has booked all the patients into a 1 hour slot, and this maximizes the use and the return on investment of paying the GP. So our GP's fees are set at £100 per hour. And so whatever you book and whatever fees you charge, you take the oops, sorry, that's my so antivirus software needs to be renewed. So whatever you charge, you take the profit on top of that. So, for example, airwax removal, face-to-face consultation, and menopause consultation, altogether that comes up to £257 for that hour. The GP fee is £100 for that hour. So the profit that you make is the income from the patients, take away the doctor's fee, which is £100. So you make £157 within the hour. You can book, you don't have to book an hour, you can book as little as 20 minutes, and that is for our online. So there's no minimum time booking at all, really. For our online sort of consults and e-prescriptions, you can just book as and when. So there's no minimum that needs to adhere to. We just say there's a minimum of an hour because you'd have to pay the GP for an hour's time, and therefore it's just better that you maximize the hours spent on the GP with booking in as many different consultations as possible. So this is our platform. This is for the GPs. So the GPs have an app. So whenever you, so the pharmacy partners, our pharmacy partners, you actually have a portal. So when you sign up, we'll give you your login details to your portal, and therefore you can shoot out jobs whenever you need to. So you could, we can walk you through it once you've signed up onto the platform. So you can shoot out your jobs, and then that goes to our app, and then it pings onto the GP, and then the GP can accept, or decline or whatever it is. But most most of the time they're accepting. So the GP, it's an Uber type platform because it's all geolocation based. So we have all the GPs across the UK, GPs near you. Pharmacies are very centrally located. So we have GPs sort of milling around there. Some of them are sort of sitting around not doing much, or it might be their day off, or they've got a free slot between patients, and they say, actually, I can do that clinic for an hour. Why not? So they can book that job and just do a 5-minute walk down to your pharmacy and deliver those services. So that's how it works in terms of on the GP side of things. Okay, and why is this needed? Because we can see the trends. I think some of the bigger pharmacies now have got their clinical services running. So I think Day Lewis and Well have recently started their clinical services. Also, you can see that actually community retail pharmacies, the margins are reducing. So a lot of them are closing. The brick and mortar stores are closing because the overheads are increasing. The margins are reducing, and it's not sustainable. So a lot of people are actually trying. A lot of the pharmacies are actually trying clinical services because that's where they make most of their profit, and that's where things are trending towards. So yes, that's it. Get in touch with me if you would like to onboard. I think you can either call us, WhatsApp us. On our website, there's a contact us form, and then we can get you sorted. So it takes like a couple of days to get you booked on after you've sort of signed the forms, and to get you registered for our CQC locations. So thank you so much for your time, and I look forward to hearing from you.